breast cancer, in order to know what breast cancer is, we first need to understand what the breasts are and what they have. So there are different parts in a breast. We have the lobules, we have the lobe, we have the fat and the nipple areola, there's the ducts, and there's connective tissue that holds everything together. So the most common sites for breast cancer to occur is in the lobes and in the lobules. And these are like milk production sites, you can say, the place where milk is produced. And then we have the ducts that carry the milk from these lobes going to the nipple. So the lobes and the lobules are the most common places where the breast cancer can begin. Cells in the breast that are growing abnormally and multiplying abnormally, resulting into the formation of a lump or a mass that could have these cancer cells in it. And it can also spread from the breast to other parts of the body, or if it began in one part of the breast, it can spread to the entire breast or to other parts of that particular breast. So we have two terms that I would like to talk about here. Number one is the invasive, and number two is metastasis. Invasive is when, let's say, your cancer started in the lobe and then it spread to the entire breast. You can say that it is an invasive carcinoma. But if it is moved out of the breast to go to other parts of the body, let's say the brain, the bones. So these are the skin discharged from the nipple, which is not milk, so it could be blood. And also there is something known as nipple retraction. That is the pulling in of the nipple instead of pulling outward. And also if you see any change in the size or shape of any breast, or if you feel pain in your breast, it is good to go get checked for breast cancer. But you also need to know that this does not confirm that you have breast cancer until you go to the hospital and do the further tests that would confirm it. So this is the peau d'orange, the one that resembles the orange peel. So number one is older age. So most breast cancers are diagnosed after the age of 50, and that is due to cell mutations that happen over time. Then we also have the genetic mutations. We have these BRCA1 and BRCA2 genes. When they mutate, you can get breast cancer. And also having dense breast, the ones that have more fat in it. And this is because more fat in the body means more estrogen production, which causes the cancer to grow more if it's there. Having a personal history of breast cancer could lead to you getting breast cancer again. Also family history of breast or ovarian cancer. Sometimes your mother, your sister could have it, genetics, sometimes your lifestyles are the same, so you could be having a chance to get it as well. And also previous treatment using radiation therapy. So people who are treated for other things before where they were exposed to radiation on the chest, it could increase your chance of getting breast cancer. And the main hormone that is affecting breast cancer is estrogen. So having an excess estrogen in the body. So one of the hormone-related risk factor is being overweight or having obesity after menopause. Also less physical activity. Basically anything that makes you overweight is a risk factor, because the more fat in the body, the more estrogen production. And if your breast cancer is the one that is so there are different types. There is the one that is the hormone sensitive one. It grows more with hormones. If it is of that type, then it could be a chance for you to get breast cancer. Also alcohol and smoking are risk factors. And beginning your period at a very younger age or reaching menopause at a very late age could be because of your body has been exposed to estrogen for a longer time. That's the reason. And also having your first child at an older age and never having been pregnant also could be risk factors. Pregnancy, it helps the cells of the breast to mature. So if you've never been pregnant before, the immature cells have a higher chance of mutating and turning into breast cancer. And there is postmenopausal hormone therapy. So there are certain women that after they hit menopause, they start getting other problems in the body like osteoporosis and all of that are hormone related. So they start taking hormone supplements for that. And when they do that, sometimes the more estrogen could increase your chance of getting the breast cancer. So how do we diagnose breast cancer? So, of course, the first thing that we do is self-examination that we need to do every month, which I will talk about later. But after that is when we go to the hospital, and the tests that are done is the breast ultrasound, the mammogram, the MRI, and biopsy. Biopsy is when a syringe is put, a needle is put into the mass, and a few cells are taken that are going to be tested in the lab to find out if they're cancerous or not. So these are a few images of the tests being done. We have the ultrasound, mammogram, the MRI. Yeah. Okay, let's move on to self-examination. So before I get to how you do it, I will tell you when to do it. So for those women who have a regular 28-day menstrual cycle, the best time to do it is after your period. And the ones who do not have a regular cycle, or they're postmenopausal, or they're men maybe, you choose any fixed day every month and you do it every month on that particular date. So how do you do it? So first of all, you need to start with one side of your, like you start with one breast. Yeah? Okay, before you get to that, you need to look at yourself in a mirror, and you need to move both arms up and down, and you need to see if both breasts are moving up, down, together or not. Is one lagging behind? Does one look heavier than the other? Does one look bigger? Are there any changes in the skin? When you're done with that, you start going to one breast at a time, and I take my left hand, these 3 fingers, and I start pressing, like I start examining it myself. I start pressing it to see if there's anything that I can feel, if it's any mass that is abnormal or, yeah. So we first start an up to down movement, and then we go for an outer to inside movement. This is for the upper part of the breast. And then we lie down and we repeat the same in the lower part of the breast to see if there's anything that we can feel. The thing about doing it every month is to see if there's any difference from what you saw the last month, so you know that you need to go get checked. So there's also, doing it in a circular motion is good, like outward going towards in. That way you will touch every part of your breast to see if there's, like, you're not gonna miss out on any part, so if there's any mass you can feel it. So yeah, so this is something that you need to repeat every month. So how do we prevent breast cancer? We've spoken about how to test, what to do, but how do we make sure that we're not getting there? So number 1 is to avoid alcohol and smoking to maintain a healthy weight, because I had explained about the overweight relation with the hormones and increasing your chance. So for that, we also need to be physically active, eat a balanced diet. Also, breastfeeding has shown advantages to prevent breast cancer and to limit postmenopausal hormone therapy. So we'll move on to the treatment for breast cancer. So the treatment always depends on the kind of cancer, how much it has spread, if it has spread to the whole body or if it's just in one area. So there is surgery option where you remove the lump that is cancerous. And there's chemotherapy, hormonal and radiation therapy. So chemotherapy is when you use medications to kill the cancer cells. Radiation therapy does the same. It is using rays to kill the cancer cells. And there's hormone therapy that blocks the cancer cells from getting the hormones they need to grow. So usually, even when we go for surgery and remove the lump, we still prefer doing radiation or chemotherapy after. So if there's anything small remaining, it comes out.